And that's the danger, that a person may feel depressed and then they misunderstand and begin to believe that they have a mental illness when in fact they're stressed out, understandably, appropriately stressed out.
Dr. O'Sullivan, we hear the word depression so often used these days. What is depression?
Depression is an illness. It's an illness that affects up to 6% of the population. So in a community of 100,000, you could have up to 6,000 people suffering from depression, many of them not in treatment. But depression is also used in a general sense nowadays. We talk about feeling depressed when we're stressed, unhappy, going through a difficult time in life. But for somebody like myself, a psychiatrist, we understand depression as a clinical illness with symptoms. It causes major disability, but of course, it can be treated, and that's the positive note when we think of depression.
Can you tell me more about the symptoms that indicate clinical depression?
There's a total of 9 symptoms that are identified with the illness, and for a person to receive a diagnosis of depression, they would have to suffer from at least 5 of the 9 and have these symptoms for at least 2 weeks. Indeed, many patients will experience symptoms for several weeks, several months, and occasionally several years. So the symptoms, the experience of depression goes something like this. First of all, obviously the person is depressed. Depressed mood or a feeling state that's there for at least 2 weeks. Usually, as I said, it's much longer. And then we have other symptoms, some of which include sleep disturbance, insomnia, or a need to sleep excessively, loss of appetite or overeating, weight gain and weight loss, fatigue, loss of energy, loss of motivation, difficulty with thinking, concentrating and forgetfulness, negative thoughts about ourselves. When we're depressed, we tend to view ourselves in a very negative way. Any faults we have are exaggerated. Any mistakes we made in our past life are seen in a very negative way. So the depressed person ruminates, obsesses about negative things, has negative thoughts, and may have thoughts that are suicidal.
So that's a wide range of symptoms. In order to be diagnosed with a clinical depression, or I think it's also called major depressive disorder, can you clarify how a psychiatrist would come to that diagnosis?
Well, obviously they would do an interview, do an assessment, and in the assessment they take a history and talk to the patient about their life experiences, how they've been feeling. They'd often look for a change in the person's life, and often a person will say, I was feeling fine up to 6 months ago, and then I started getting depressed. I had no energy. I was unable to get to sleep at night, or alternatively, I could get to sleep at night, but I'd wake at 4 or 5 o'clock in the morning, and I'd spend the rest of the night twisting and turning. Perhaps the person would then complain of loss of appetite and weight loss, no energy, difficulty concentrating. And so all of these symptoms would evolve over a period of time, usually as a reaction to some adverse experience in life. And in the interview, in the assessment then, I would identify, symptom after symptom. And if I found that the person had 5 or more symptoms, and these were present day after day, and as I said earlier, at least 2 weeks in duration, I would then feel confident of making the diagnosis of depression, clinical depression, or major depressive disorder.
Mm. So the word depression does get used quite frequently these days in common language. Do you find that it is used appropriately? Is it sometimes too casual?
Yeah, that can be a problem. Often we hear talk of depression, that a survey has been done in a major corporation and 30% of the employees are suffering from depression. And then I say to myself, what's happening here? Are we overusing the term? Is it, as you say, is it used in a too casual sense? Are we trivializing the diagnosis of depression? And so if somebody is suffering from a depressive illness, people will have difficulty understanding how potentially serious that can be. So I do think that we need to redefine the word depression, or redefine the concept of depression, and be more careful when we talk about surveys of people being depressed. So when somebody says they're depressed after some adverse experience, they've lost a job, breakup of a relationship, that is an indication of their distress level, their unhappiness. That doesn't mean they're suffering from clinical depression. And that's the danger, that a person may feel depressed and then they misunderstand and begin to believe that they have a mental illness when in fact they're stressed out, understandably, appropriately stressed out because of some significant adverse or life experience.
So are there different levels of major depressive disorder or clinical depression?
Yeah. Depression is a complex illness. It can present in many different ways. Mild depression, moderate depression, severe depression. Like any illness, depression can present at different levels of severity like that. Depression can occur, of course, coexisting with anxiety. Depression can be part of a bipolar disorder. Depression can be dominated by anxiety symptoms. Depression can be linked to the seasons. I'm sure we all know of winter depression, seasonal affective disorder. So depression can be complex. It can be a single illness, just depression alone. Also, depression can occur in a person's life just once, and we call that single episode depression. Or more commonly, more frequently, depression can recur at certain times in a person's life, and we call that recurring depression.
Mm-hmm. So with these levels of depression, you mentioned mild and moderate and severe. Can you give an example of what that experience would be like for someone, what their life would be like?
Depression changes reality for us. It changes reality because our perception of reality, the way we see life, the way we see ourselves and the future changes. And then, depending on whether we're mildly, moderately, or severely depressed, that will determine the degree of pessimism, the degree of sadness. If I'm moderately depressed and I'm going through a depressive experience, I'll wake up in the morning and have a sense, what's the point of life? I'll have no sense of motivation. My energy level will be low. I'll find it difficult to be enthusiastic about things. Often, as I go through the day, I find I don't have an interest in things that I were interested in. I may find that in relating to people, I'm irritable and moody. I may withdraw in my relationships. At night, when I'm tired and I'm exhausted and going to bed, I find I can't sleep. Or if I do sleep, I'm awake at 4 or 5 o'clock in the morning and I can't get back to sleep. And so day after day is experienced in this way. And as time goes on, of course, and as my depression gets more severe, all of these symptoms become an enormous burden.
And I know some people experience an ongoing level of the mild end of depression. And then there are other cases where it is incredibly severe. So for example, I know of someone who just has this ongoing mild sort of dissatisfaction and unhappiness, whereas I've heard of others who just can't get out of bed in the morning. Mm-hmm. And so these are all considered the illness of major depressive disorder.
They are the different manifestations of depression. The first one you describe, where a person has a chronic mild depression, nowadays that gets a diagnosis or a label, chronic persistent depression. Very often people will have that condition for years. In fact, for some people, they will think that's the normal for them. And then something happens, a crisis happens in their life, they see a mental health expert, and they discover, no, that this is not normal. Mm. And for a person like that, life is grey. They find it very difficult to be enthusiastic about things. And day follows day. But because it's not severe, it doesn't incapacitate them. They can continue at work. They can be involved in a relationship. But they live a kind of half-life. They don't have the experience of joy and high energy and enthusiasm that we expect in our lives.
And when a person is severely depressed, a psychiatrist would assess them as severely depressed. What would that be like for the person?
It's really a debilitating disorder. I've worked with depression for many, many years, and so many people have said to me, I would prefer any illness than severe depression. It's an unpleasant, disabling illness. Very often a person, when they're severely depressed, all they want to do is stay in bed. They have difficulty concentrating. They are preoccupied by negative feelings about themselves. They have no sense of a future and will feel hopeless about the future. They may have many negative thoughts, and sometimes they have thoughts of suicide. And at times, a severe depression can be a crisis in the person's life, needing crisis intervention.
We often hear as well that people saying that they have depression and anxiety. Increasingly these days, we're hearing those two terms used together. So why is that the case, that we often hear depression and anxiety?
Yeah, depression can often coexist with another psychiatric disorder. It can also coexist with medical disorders. But depression and anxiety are very common companions, if I can put it that way. About 50% of depressions are, as I put it, accompanied by anxiety, depression, anxiety. So a person can develop a depressive illness and later develop an anxiety disorder in addition to that. The other side of that coin is a person can suffer from anxiety, and after time, they can also suffer from depression. So depression and another psychiatric disorder can coexist. A person can have an addiction, alcoholism, and over time they develop alcoholism with depression. And both conditions have to be treated. Depression and schizophrenia, depression and post-traumatic stress disorder. So that's quite a common experience for a psychiatrist like myself to encounter. I see a patient, they're referred because their family doctor thinks they are depressed. I do an assessment and I find that depression is coexisting with another psychiatric disorder.